Good afternoon and welcome to today's Downing Street press conference. I'm joined by Chris Whitty, Chief Medical Officer, and Sir Patrick Vallance, the Chief Scientific Advisor. Can I start with an update on the Prime Minister? He's still in intensive care, but he continues to make positive steps forward and he's in good spirits. And I can also report from the government's ongoing monitoring and testing programme that as of today, 243,421 people have been tested for the virus, 65,077 have tested positive, and the number of people admitted to hospital with coronavirus symptoms now stands at 16,784. And of those who have contracted the virus, 7,978 have sadly died. And our thoughts and our prayers are with their families and their friends. The whole country has been practicing a stringent form of social distancing for 3 weeks now, precisely because we're doing everything we can to minimise the bleak numbers that I just read out. And for that, I want to say a massive thank you to everyone who's gone the extra mile during this very challenging period. Thank you to all of those who are looking after us in our time of need, the NHS workers on the front line who have treated the sick, saved lives, and tended for those who sadly could not be saved. For the doctors and nurses who have died of coronavirus whilst caring for others, we will never forget their sacrifice. We will never forget their devotion to helping others. And I also want to say a big thank you to the carers, the charity workers, all those looking after, or even just keeping an eye on, those in their local neighbourhood. You are the lifeline to so many people in our communities. Thank you to the workers who keep the country running, the supermarket workers, the delivery drivers, the technicians, the cleaners, the public servants who just kept going, determined to keep providing the daily services that we all rely on. I think you've certainly made us all think long and hard about who the key workers are in our lives. Thank you to the volunteers who have stepped up across the country, whose big-hearted sense of responsibility defines British community spirit at its very best. And a massive thank you to every single person who stayed home to stop this terrible virus from spreading. You've helped protect the NHS and you've helped to save lives. Now, as we look forward to the long bank holiday Easter weekend, I know some people are going to start wondering, is it time to ease up on the rules? So I say thank you for your sacrifice, but also we're not done yet. We must keep going. Let me just explain a little bit about why that's so important. Today I chaired a COBRA meeting with senior ministers, officials and representatives from Scotland, Wales, Northern Ireland, as well as the Mayor of London, so that we could take stock and assess where we are right across the United Kingdom. And at this stage, the government is continuing to gather all of the relevant data to obtain the fullest picture possible of the effects of the social distancing measures that we've put in place. Now, while the early signs suggest that they are having the impact that we need to see, it's too early to say that conclusively. SAGE will meet next week to discuss the latest evidence and will keep the measures we put in place under review. As we've said on many occasions now, we'll be guided by the science at all times. So we don't expect to be able to say more on this until the end of next week. And let me just be, again, very clear about this. The measures will have to stay in place until we've got the evidence that clearly shows we've moved beyond the peak. Now, I know these restrictions take their toll day in, day out on people's livelihoods, on people's quality of life, on people's mental health. And I appreciate that it's often the little things that hurt the most. With the Easter bank holiday coming up, I'd normally spend it with my two boys, 7 and 5 years old, with their grandparents doing an Easter egg hunt. And I know there's going to be lots of people who would normally be planning a family get-together or just getting out in the sunshine with friends and loved ones. Unfortunately, right now, we just can't do those sorts of things. And I'm really sorry about that. But just take a moment to think of the progress that we've already made. following the guidance, staying at home, denying the virus what it needs to spread more easily and to kill more people. It's been almost 3 weeks, and we're starting to see the impact of the sacrifices we've all made. But the deaths are still rising, and we haven't yet reached the peak of the virus. So it's still too early to lift the measures that we put in place. We must stick to the plan, and we must continue to be guided by the science. Our top priority, our immediate priority, remains to slow the spread of the virus and to save as many lives as possible. That's why we have to continue to ask you all to keep complying with the guidance. And as we've said consistently from the outset, it's vital we take the right decisions at the right time. And the most important thing right now is that people continue to follow the government's guidance until we've got the evidence that the virus is firmly under control. So that means please do stay at home to protect our NHS and to save lives. After all the efforts that everyone's made, after all the sacrifices so many people have made, let's not ruin it now. Let's not undo the gains we've made. Let's not waste the sacrifices so many people have made. We mustn't give the coronavirus a second chance to kill more people and to hurt our country. I know it's tough going, but this is a team effort, and we'll only defeat this virus for good if we all stay the course. So please stay home this bank holiday weekend for everyone's sake. And I will turn to Sir Patrick to give us an update on the very latest data. Sir Patrick, over to you.
Thank you very much. As the First Secretary has said, the measures that everybody has taken, the difficult things that we've all had to do, are making a difference, and they're making a big difference. We know that the social distancing is working, and we know that people are doing what they're supposed to do, and we need to keep doing that. And the reason we need to keep doing that is because it stops the transmission of the virus in the community, and we know that that is already happening. Next slide, please. As a result of stopping the transmission in the community, we stop new cases appearing. And this slide, the numbers go up and down a bit, but what you can see is it's not taking off in that sharp uptake. It's not gone sky high. And if anything, there might even be some flattening. That is because of what we're all doing with social distancing. If we had not done that, those cases would now be very much higher. If those cases were higher, next slide please, then this graph wouldn't look like this. We would find many, many more people in hospital. We would find the health system potentially overrun. And what you can see on this graph is the increase in hospital admissions, people in hospital beds with COVID, and it has gone up across the country, but it's not gone up in that steep way. And again, if anything, we're beginning to see the first signs of this levelling off. Too early to be sure, too early to know that this is on the way down, but it's not got that fast upswing that it would have had we all not been doing what we are doing with these difficult measures of social distancing. And if the hospital beds were fuller, next slide please, then importantly, so would the intensive care units be even fuller. And people are working heroically in intensive care units to look after the very sick patients who are there. But again, this is not the sharp upstroke of big increases in numbers. It's a steady increase in numbers, which might be beginning to flatten off, but it's certainly not accelerating. That means that the NHS can cope. It's got the right numbers of beds with the new expansion in order to be able to cope with it. So if we were not doing what we're doing, and if we don't continue to do what we're doing in terms of the social distancing, we put all of this at risk. We jeopardise the thing that's allowed us to get to this position. And if I can have the last slide, please. Unfortunately, sadly, there are deaths from this disease. And those continue to rise, and you can see here the increase in rise in the UK and in other countries. This will not change for a few weeks because the deaths come after the other illnesses, the early illness, the intensive care, and then in some patients, unfortunately, die. and that will continue to increase for a few weeks. We need to see this begin to go down as well. It should follow the others. So the message is clear, which is the social distancing that we're all doing is breaking transmission. It's stopping the hospital admissions, beginning to see that flattening off, still unbelievably busy, but beginning to see that flatten off. It's preventing more people going into intensive care, and it will prevent deaths. It's incredibly important we continue to do what we're doing.
Thank you, Patrick. Now, if we take some questions from the media, I think Hugh Pym from the BBC is first up. Hugh.
Thank you. We've heard some harrowing stories of people dying alone because family can't be with them for understandable reasons to do with the virus risk. What do you say to the British public about how things will develop from here?
Well, the first thing I would say is thank you for all you're doing, not just the key workers, as essential as they are, and we applaud them for the incredible work they've done, but also to every individual who's followed the advice and the guidance. But we've made progress. Patrick has set that out, I think, very clearly. But we don't know conclusively that we're beyond the point at which we could start considering whether the measures will be relaxed. So we must keep it up. And I think the key thing is for people to understand how much of what they've already done has helped contribute to avoiding an even worse situation in terms of the spread of the virus and the number of deaths, and how important it is that we don't slow up or take our pressure off at this critical moment before we've come through the peak. So we recognise the sacrifices so many people have made. It's a team effort, and as a country we need to be united in this mission. We've got to keep it up. Did you want to come back with anything further, Hugh?
Maybe to Patrick Valence a little bit more on the death projections that you have got. I know it's difficult, but how long and how fast you expect the deaths to carry on rising?
In general, I'd expect the deaths to continue to keep going up for about 2 weeks after the intensive care picture improves, and so we're not there yet in terms of knowing exactly when that will be, but that's the sort of time frame I'd expect.
Sam Coates from Sky.
I suspect Britain needs a little bit of hope going into this Easter weekend. To Dominic Raab, will the government set out in public the principles that will guide you when you do finally come to lifting this lockdown? Angela Merkel, the German Chancellor, said today that the German government would do that next week. Can you commit to doing something similar? And to Chris Whitty, 2 or 3 weeks ago, you were very concerned about the speed that the coronavirus was ripping through communities. Can you say how fast it is now going and being transmitted? Has that transmission rate now come down, or is it still going through Britain as fast as it was?
Thanks, Sam. Well, look, the positive is that I think, as we hopefully set out clearly, we can show people that all the sacrifices that they've been made and all the forbearance that they show has made a real difference. It has saved lives. It has helped protect the NHS. And we're obviously not on the same point along the peak as the Germans, so I'm not sure that the direct analysis works, but what we will do is continue to be followed by the evidence and the science, and as we've always said, and as I said earlier, we'll take the right decisions at the right moment in time.
Answering directly the question that you asked about the speed, at the time when I was first talking about this, the doubling time, how fast we were doubling in terms of numbers, particularly in intensive care, was around about 3 days. There it is. This has got steadily longer in time over the last 2 weeks, thanks to what people have done. And as Sir Patrick showed in the data, this is really now becoming not quite flat, but it is doubling time is now 6 or more days in almost everywhere in the country and extending in time. That has only happened because of what everybody has done, what we've all done in terms of staying at home and only going out to work, exercise and critical shopping and medical care. If I can just add one thing in terms of the principles, and this is not principles except in the narrow sense of health. I think it's important to remember that there are the direct effects of people dying from coronavirus, and this has been affected by people helping to pull the curve down. But there are also indirect effects which have to be taken into account when we're thinking about the health effects over the long term. Those include the indirect effects were the NHS to be overwhelmed,